Few things in this world can be more devastating than someone that suffers a serious physical injury. And certainly, if that person depends on their livelihood as a result of their body, they're in real trouble, physically, emotionally, and for that matter, financially. So what to do? What does the road to recovery hold for you? Well, you've got a lot of challenges unless you find a rehab center that knows how to get it right by doing it right.
We realize people have choices in medicine. When I was working with some of these big orthopedic places, we took care of Michael Jordan and a number of the big baseball players, including Larry Walker, etc. And the Saudi royal family would fly in to see Dr. Andrews. And we felt that that kind of care is not just, you don't have to be a celebrity to get that. We wanted to make sure we had well-trained doctors, physical therapists, occupational therapists, multidisciplinary center that everyone's entitled to. So that's how the concept came out. We wanted people to choose us because we had everything they needed.
With patient choice, I've had real treatment. I've had real therapy. You know, when they fix the problem, then they start just working with my rehabilitation. And ever since then, that's who I'm with. And that's who I'm going to stay with. You know, I look at the fact that I'm 51 years old, and our bones don't heal quick when you're the age I am. And my husband and my daughters, they worked with me. You can imagine me not walking. You know, I had children to get to school. This is a great place. I'm not saying it just because I go there. I'm saying it because I'm here. I know what they've done for me. I know how far I've came. And I have came a long ways. And I'm getting better every day.
We do have a full clinical staff. It's truly multidisciplinary. We have PTs, OTs, PhD psychologists, LPCs, MDs, and it's a team approach. It's a whole team approach to the total patient and healing them and getting them back to either fully functioning or as close to fully functioning as we think is achievable. Some instances it's just not achievable. I've worked in other situations with other systems that the patients didn't get everything they needed, that they were a little afraid to provide the care that was necessary, afraid of taking on the insurance carriers in certain instances, where patient's choice just takes care of the patients.
They're very compassionate, very helpful. Any problems that I've had, they've overcome them through the insurance company or through whoever I was having the problems with. Ken White would resolve the issues, and within a few days, everything would be resolved. I would recommend patient's choice. The physical therapy, I mean, they care. I'm an older gentleman. And, you know, I didn't know what to expect out of this stuff, but I wouldn't leave there. If you've got a legitimate issue, they will resolve your problems for you.
The majority of our work is in the injured worker side. Work-related injuries, there's also a large percentage of people that have, they've been in a motor vehicle accident or they've had some injury like that as well. We do have some post-operative rehab as well that we do. We even actually do family medicine at one of our clinics. I'm proud of the fact that, we've been able to get to a point where we can offer quality care to the average person. It's nice to know that we've created a system when we've weathered the storm, we've been able to do that and provide quality care for everybody.
If it wasn't for patient choice, I'd probably be in a wheelchair. I'm already handicapped and disabled at 50. But Dr. Dan and patient choice actually put forth more effort than what was needed to help me. Even when work would come say you can't go back to therapy, he would let me come. And there's not too many doctors at this time and point would even see you if your time is up for his paperwork. But without patient choice, I wouldn't have a clue. I mean, he did my chronic pain management. He actually sent me to the right doctors to see, because with workers' comp doctors, they just assume, okay, this is it. But without Dr. Dan, I probably wouldn't even be walking.
We fight as hard as we possibly can for every single patient, and we do everything we can to get them reintegrated back into their life, at least the best quality of life that they can have, and that's extremely rewarding every day. It makes it worth some of the work that has to be done to actually make that happen. They make the system incredibly complex, so the average person or average patient can't really understand it. They don't get their needs met. I make sure that I understand their system, all the ins and outs and nuances, to get the patients the care they need. It's about good quality patient care. Just stay away from everything that is not driven by getting the patients better. And at the end of the day, I think we provide a better service than other facilities, other providers can, because this is what we've been doing forever. This was his vision for the company, and we've cultivated it and grown it to what it is today.
The insurance companies, they don't care. I mean, they're in business. And I've heard this over and over and over for the last 2.5 years, nothing but problems. Ken, He's just been a wonderful problem solver. I think he enjoys problems. And, you know, and that's nice to have on your team, somebody that enjoys the problems and resolves them. There's nothing that I hadn't had resolved with Patient's Choice.
In fairness to the insurance companies, they're a business, and everyone has to realize that they're a business. And businesses, as we know, they're trying to maximize their profit, and there's only two ways to do that. How much you bring in, your revenue, and you have to limit your costs. Fair or unfair as it may seem, insurance companies have systems that are in place for their employees, whether they're adjusters or case managers, to minimize costs, and that often means minimizing care. Our role at Patient's Choice is to be a patient advocate. We're trying to provide the appropriate care for patients. We're advocates to get that care approved. And when I say appropriate care, there's care that's medically necessary, meaning they actually medically need it. And then there's the care that they are entitled to. And they're entitled to it because in reality, the employer is paying for workers' comp insurance often, and that's coming from the employee's salary, whether it's directly or indirectly. So that means that person, if they medically need care, well, it's their right to have it. Our goal at Patient's Choice is not to provide inappropriate care or to overtreat. It's to provide the necessary care that the patient is entitled to and get them back as fast as possible.
So think about it. Need rehab services? Patient's Choice could be your best choice.